Hi, this is Deb from Dynamic Piercing and Tattoo, and I am creating this video for you to watch. It is a requirement before you come in for your piercing. I would normally do this when you were in for your piercing, but due to COVID-19, we're trying to limit exposure, so people are not in the same area for very long. So that's why I want you to watch the video before you come in for your piercing. This is not meant to replace medical advice at all. It is not medical information. It is simply piercing information for you to help you understand piercings a little bit better so you'll have a good outcome. It does not replace medical advice. If you need medical advice, you'll always want to contact your provider. So some of the risks of piercing. First one is reaction to jewelry. Not too worried about that. I use two types of metals, 316 LVM implant grade surgical stainless steel or grade 23 titanium, which are both very biocompatible metals in the body, which reduces the risk of having an allergic reaction. Now, metals are still a foreign object, and the body doesn't like foreign objects, so you can always have a problem even with the biocompatible metals. But generally speaking, those two types of metals really reduce that risk tremendously, so I'm not too worried about that. If you did have a problem with an allergic reaction, even using the biocompatible metals, number one, if we start with the 316 LVM implant grade, we can switch over to grade 23 titanium, see if that does better. If you don't do well with either one, sometimes people just can't have piercings, unfortunately. Reaction to jewelry is a totally different thing than infection, but people mistake the two all the time. That's why if you have a concern about your piercing, something you don't understand, I would really rather you contact me. Don't guess, don't go online. Please don't go online. Don't ask your friends, okay? Just contact me. I can usually figure out what's up with your piercing and what we need to do to get it back on track so it's behaving. Another risk of piercing, of course, is rejection or migration. Again, the body doesn't like foreign objects. So there's some piercings the body has an easier time getting rid of, the navel and the eyebrow. Surface piercings, basically. And what it will do is it will actually heal behind the jewelry, forcing it through the tissue to the surface and out. The jewelry can actually cut through like a cheese slicer, just like you're slicing through a piece of cheese. So that's why there are important things to consider when doing piercings. Gauges, depending on what body part you're piercing. That's why you never want to pierce yourself at home. There's a lot to know about piercings. But anyway, so if we think that the piercing is actually rejecting, then it's a good idea to take the jewelry out before it gets pushed all the way out. You're going to have a smaller scar. With migration, sometimes we can train the piercing to go back the way that it should. Again, just contact me if you have questions or concerns regarding that. Let's see here. Another risk of piercing is bleeding. Bleeding is normal. It's nothing to worry about. As long as you don't have any medical conditions, bleeding generally stops pretty quickly. It is also normal to have some spotting on your, pillowcase or your bed sheets if we do body piercing. It wouldn't be a lot of blood, but it's not atypical for that to happen. The problem would arise if you have an underlying medical condition that you don't know about and the bleeding is just not stopping. So in that case, you would absolutely want to seek emergency treatment, medical treatment, okay? Don't hesitate if you think the bleeding is abnormal or it's not stopping. The biggest risk of piercing is always going to be infection. Bacteria is typically what causes infection. There's other things that can cause problems too. Funguses, of course, viruses. If you got herpes into the wound, you could have herpes reappear in that area all the time. So there's lots of things that can cause problems. Typically, it's bacteria, though, causing infection. Bacteria live on every surface. You cannot escape that fact. So your hands are the number one carrier of bacteria because we touch everything all the time. Even washing hands doesn't get rid of all the bacteria. It is very, very important. As a matter of fact, the most important thing to remember about your piercing is to not touch it. That's the most important thing. And by the way, cleaning a piercing Has nothing to do with keeping a piercing from getting infected. That is not why we clean a piercing. I'll go into cleaning more in a minute. But touching is the biggest reason people get infected piercings, and there should never be a reason to touch your piercings, including no turning jewelry. You do not need to turn jewelry in a piercing. That is really bad information that's been passed around for years, but it's just not true. You don't need to turn a piercing. I'll go more into that in a minute also. But no touching a piercing is the best way that you can reduce the risk that it gets infected. Now, you can do everything right and still wind up getting an infected piercing and not know why. Bacteria live on every surface. Your home is packed full of bacteria. I don't care how clean you are, it's everywhere. Your bed sheets have bacteria on them. So you can always get an infection when you have an open wound. If the body were to get infected for some reason, or the piercing site were to get infected for some reason, I don't advise taking the jewelry out, because then the tissue can seal around the infection, trapping it inside and causing it to get worse. Usually it's better to leave the jewelry in place so that the hole stays open, the infection can drain. If you do get an infected piercing and you take the jewelry out, then you trap that infection inside, you can start to build an abscess, and that would have to be drained from the outside anyway. So by leaving the jewelry in place, the wound can drain on its own. Never try and clear up infection on your own. And by the way, it's really hard to decipher, is this infection, is this reaction to jewelry? So contact me, I can usually figure it out. If I have some indication that, I think you need to go to the doctor, I'm going to tell you to go to the doctor. And by the way, never hesitate to seek medical advice or go to the doctor, ever. Don't stay home and try and guess. If it's something you don't understand, go to the doctor. You can never go wrong, let's put it that way, going to the doctor, but you can go wrong if you stay home, and you should have went. So at any rate, I always recommend usually leaving the jewelry in place if you have an infected piercing, seeking an appointment with your doctor so that you can get treated for that infection. Infections can turn bad really quick. You don't want to mess around. You don't want to wait. You want to go to the doctor, okay? So again, if it's something you don't understand, even if you think it's a reaction to jewelry, you might want to go to the doctor just to be sure. You want to be safe all the time. Now, as far as, let's see, I was talking about turning the jewelry. So a lot of times you might have been told to turn the jewelry when you got your ears pierced. That's not good information. People who tell you to turn the jewelry will think that if you don't turn it, the skin is going to try to heal to the jewelry post. That's not true. Your body cannot approximate to a non-porous surface. In other words, your body cannot heal to the jewelry post. So when you turn jewelry into piercing, what you're doing, number one, you're touching the jewelry, you're touching the piercing site. And every time you do that, you increase the risk the piercing is going to get infected. Number two, when you turn the jewelry into piercing, your body is trying to heal the wound inside. When you turn the jewelry, you're tearing the healing process that's trying to take place in there. So you're setting it back in healing, okay? And number three, you can increase the risk of swelling when you turn the jewelry into piercing. So all things that you want to avoid. Don't turn the jewelry into piercing. You don't have to, I promise. Which brings me to cleaning. People think that they have to clean a piercing so it doesn't get infected, and that is actually not true. So let me talk about that. The reason that we clean a piercing. A piercing is a deep puncture wound. It's a tube. So your body wants to heal this wound. What happens when you have an open wound? There's open tissue inside the piercing. And you leak body fluid. That body fluid is carrying healing cells to heal the wound. But the body fluid is naturally wet. So what happens is the body fluid is leaking out of the tissues inside the wound. Then it rolls outside, the air hits it, it dries, and it gets crusty around the outside of the piercing. That's why piercings get crusty. It's just body fluid rolling out of the wound, which is normal, and then the air hitting and drying. And then you have a crusting or a scabbing that's attached from the tissue to the jewelry post. the reason people tell you to turn the jewelry, even though they don't know this, is to break that crusting off. But when you do that, like I said, you're touching it, increasing the risk of infection. You're tearing the healing process, increasing the risk of infection. And you're just setting the healing back. So that's why you don't turn the jewelry. And the only reason that we actually clean the piercing is to get the crusting off from the outside of the piercing. That is absolutely the only reason for aftercare on a piercing, is just to get the crusting off the piercing. We don't want to use any foreign liquids on a piercing. Your body doesn't like foreign liquids anymore, it likes foreign objects. Sometimes people hand you a product that might have bleach in it. You don't know it's bleach because you can't understand the term that it is. It's like some long H thing. I don't even know. Anyway, and then they'll tell you turn the jewelry and get the product inside the piercing hole. The only thing inside of a piercing hole besides a sterile piece of jewelry are healthy healing tissues. Nothing else belongs in there, including no foreign liquids. So what happens if you use foreign liquids, you turn the jewelry, you get it into the wound, your body's going to respond by wanting to get it out of the wound. So it's going to send more body fluid to the area to flush it out of there. And the result is going to be a lot more swelling in the area, a lot of redness and irritation, and a lot more crusting, oozing. It's kind of gross. And it's the number one mimicker of infection when people use improper aftercare products. So the only reason we're cleaning the piercing is just to get the crusting off the outside. I am going to provide for you a sterile saline spray. It's very easy to use. You're just going to mist the area. You don't turn the jewelry. You don't try and get the product inside the wound. It's wet. The wetness kind of loosens the crusting. It is salt water, so it dries it down. And then it flakes off on its own. And you don't have to use anything else. And if you forget to spray it, or to use the aftercare, it really doesn't matter. You haven't lost anything. Aftercare is really not that important on a piercing. People think it's the most important thing, but it's not. The crusting will turn loose on its own anyway, eventually. It's just that the spray can help it turn loose a little quicker, which allows more air circulation, which helps in healing. Let's see here. So that's about it as far as my spiel goes. I will talk to you a little bit more when you come in. You'll pick some jewelry. The jewelry type that I use will really be dependent on what we're piercing. We want to use jewelry that accommodates swelling. Hugely important. A lot of people don't take that into consideration. There's a lot to know about piercing. So anyway, I'll see you when you get into the studio for your appointment, and I hope this has been helpful. Again, if you have questions or concerns, you're going to contact me by emailing me, or you can always text me, which you'll have my card when you leave from your appointment. So thank you for watching, and have a great day.